when somebody or something is exposed to danger, harm, or loss. Most of the times we refer to risk as with the negative connotation that something bad or something adverse is going to happen to that person. That's the risk. Uh, we have risk, as we said, ubiquitous. So in various sectors, not just health, there's financial risk, there's risk at workplace, there's risk to health. So there are various definitions that focus, that try to quantify risk in terms of probability. What are the chances that I'm crossing the road and I get hit by a vehicle? So that's my risk. There's a 10% chance or a 1% chance or whatever. Risk can also be seen in terms of threat as to how big a damage is going to happen. There's a risk of a huge landslide and loss of lives, livelihoods, and things like that. And all outcomes versus negative outcomes. Risk, most commonly in our day-to-day language, we try to focus on the negative outcomes of things when we refer to risk. Next, please. However, there's another way of looking at risk, and this is the Chinese symbol for risk. I find it very interesting and use it in my slides when I talk about risk communication. It's a combination of danger and opportunity. So it's not just about the negative connotation that the Chinese symbol for risk represents. We are also talking about both. There's a downside, which we have referred to. Most of the times we look at that, but there's also an upside of risk. So without COVID-19 pandemic, probably we would not be having a series focused on public health emergency and disaster management people coming together, or maybe resources pooled into the health sector or infrastructure. So this is one of the better ways of looking at risk. Next, please. Also, there's this component of when we talk about risk, we should be very careful as to in which domain do we predominantly lie. So there's this hazard component and an outrage. This is the classic Peter Sandman model. He is one of probably considered as one of the greatest risk communication experts to have ever lived. And he says that there's a component of hazard and there's a component of outrage when we are referring to risk. Now, hazard is the technical or the scientific measure. It can be measured as to what is going to be the impact, how many people are going to die, how many people are going to be hospitalized, what is the infectivity, etc. While the outrage is the emotional aspect, how much rattled or how much disturbed people are going to be with that event. So if we look at this, when we say we are talking about crisis communication, we are looking at a situation where there is very high hazard. I mean, scientifically, technically, the situation is alarming. There's likely to be lots of lives lost or lots of hospitalization. And also people would be very much concerned about it. So in that situation, we look at crisis communication. So risk communication, but in a crisis setting. While on the other hand, if we look at, there's a lot of outrage, but almost minimal hazard. The example that I'm going to give is probably not the best of the examples, but it's the most recent one. So the Ahmedabad plane crash. We know that plane travel is one of the safest travels currently available. But when such an event happens, the outrage is far, far higher than what is the actual hazard. The risk of the probability of anybody dying in the plane crash is very minimal. But when that happens, the outrage of people that hits its ultimate heights. So there we have to do outrage management. While there is another component where the hazard is actually very high, but there's hardly anybody concerned about it. Like riding a two-wheeler at night time on any of the Indian roads for that matter, just to take it in a lighter vein. So we know that India leads the world in road traffic accident deaths. And out of them, two-wheeler deaths account for the maximum, pedestrian and two-wheeler deaths account for the maximum ones. So, but there we do not think twice. People do not think twice that this could be an hazardous activity. While the actual hazard is very high, people would not be concerned about that. So there we have to focus on what is known as precaution advocacy. And if there is no hazard, there is no outrage, we don't talk about such situations. So this is the model that looks at risk from the angle of hazard as well as outrage. Next, please. So once we understood the basics of risk, we can now talk about risk communication and then maybe about community engagement. So these two terms are slightly different, but they have now been as a principle, they are being used together, risk communication and community engagement, because one leads to the other. So risk communication, as we understand, it's a dynamic approach to addressing challenges ranging from public health crisis and natural disasters to social and economic uncertainties. It's a two-way dialogue. So the community which is affected and the people, the teams which are responding, health, emergency, disaster, animal husbandry, they would form the responder team. So between the community and the responder, it's a two-way dialogue. And ultimately, it empowers communities to actively participate in decision-making process, decisions that affect the response, decisions that affect the long-term outcomes of that particular emergency. Next, please. If you can quickly take me through a couple of slides and jump ahead. I'm just trying to correlate if this slide deck is the same that I had requested the team to upload and share. That was the last version. This doesn't appear to be the same deck. I could refer to this slide deck as well, but then I'm mentally prepared to go through the deck that I had last change. So if that's possible, my team here, I'll request if that can be done quickly without breaking the flow of our webinar. And I think it was downloaded on this.
So then I'll have to recheck if it is.
Meanwhile, your comments on the chat box, they are most welcome if you can keep typing those comments. Okay. Sorry about that slight glitch. This happens when we do not communicate effectively. So that's, I owe an apology to the group. This was the last moment changes that I had made, and a different deck is being used. All right. So we had already gone through this. Yes, next, please. Yeah. So we were just a slide before this. No, the other way. Previous slides. This one, yes. So we were talking about risk communication and community engagement, and we said that ultimately it empowers the community in a decision-making process to actively participate in the decision-making process. Next, please. The WHO defines risk communication as a two-way and multi-directional communication and engagement with affected populations so that they can take informed decisions. Basically what was said on the earlier slide too. And these informed decisions are meant to protect themselves and their family members, loved ones. It's also defined in some other context as the real-time exchange of information. So this component is especially important when we are talking about risk communication, that the information exchange has to happen near real time. I mean, it's not a letter writing or an email communication or a grievance flagging activity that we are undertaking. So people are sitting face to face and they are exchanging this information, advice and opinions in a real time basis. Next, please. The risk communication should ultimately result in why risk communication and community engagement have been clubbed together, because ultimately the aim of risk communication is that the community feels empowered and they have that information where they can make decisions based on that information. They are able to make decisions. That is the engagement. When they become partners in decision making, that is when they say that the community is truly engaged. So it involves partnerships and coalitions. It is essentially a process of working collaboratively with and through groups of people. Next, please. So when we talk about the community engagement continuum, there are levels of community engagement starting from the most basic level wherein we talk about outreach. When the health system or the responders, they are reaching out to the community, like temporary camps being set up, shelters being set up, some medical services being provided. That is an outreach. An immunization camp in an affected population, displaced population is an example of outreach. From there, if we move on to shared leadership, that is the pinnacle of community engagement, wherein people feel empowered, the community feel empowered that they are sharing leadership, they are owners of the resources, and they are equal, they have an equal voice in making the final decisions. Next, please. So these are some of the principles of community engagement. We'll talk about them in more detail as we move ahead, but basically the context is the most important thing. Trust building, without trust building, community will not respond to whatever initiatives the government or the system or the responders undertake. There has to be a buy-in ensured and it has to be maintained as well. Why would the community be willing to share its information and have a dialogue in the first place? It also depends on facilitating community-based solutions, leveraging community capacities and resources that generate a community workforce. So the community themselves become the responders. There has to be an honest and inclusive two-way communication where there is more of listening and analysis and respond to social science data and feedback. So these principles, they sound like too much in theory, but when we actually apply them, most of them are logical, based on which this community engagement is planned. Next. So we talked about risk, we talked about risk communication, and we talked about risk communication leading to community engagement. Now this can be quite different in the context of crisis. So for that, we also have to little bit understand the psychology of the crisis. What is a crisis and how people behave in a crisis. Next. So what happens when a disaster looms or an emergency looms? What do people feel? People would be psychologically inclined to first of all be in a denial mode that this cannot happen to me, this cannot happen to my loved ones, this cannot happen to the community where I live. There would be fear, anxiety, confusion, dread even. At some stage, it may translate into hopelessness or helplessness. I mean, now nothing can be done. And sometimes panic may set in if the crisis is of that nature that people may become absolutely panicky. So this is the crisis. This is the background against which we have to propose our solutions, that people are in this state of mind when we are talking about crisis. Next. And therefore, communication in a crisis becomes different from a routine communication. When we go and talk about in a happy community which is not affected by a crisis, and we are trying to tell them the benefits of COVID-19 vaccination, that's a different thing. But when we are talking about the second wave of COVID-19 looming, people actually facing it, and then we talking about COVID vaccination benefits, I mean, that's absolutely different. So communicating in a crisis is different because through this, the public must feel empowered. The primary objective is that it should reduce fear and victimization. The mental preparation of this community through these messages, it reduces anxiety. It motivates them to take action, and any action taken during a crisis situation, it reduces anxiety. So that catch-22 situation or the loop of fear, anxiety leading to inaction, that is broken by this communication. And uncertainty must certainly be addressed during a crisis period. Next. Therefore, when we know that people think differently, people behave differently, we communicate differently, so the decision making is also accordingly affected. People tend to simplify the messages, especially during a crisis period. So we may be giving 10 different messages, people may just pick up one or two out of them. So our messages have to be very, very simple. They would cling to current beliefs. They would not change what we want them to do, because they know that something which they have believed in has got them so far. So it is likely to take them further during this crisis as well. So people would not change beliefs during a crisis situation. And they remember what they have seen previously. It's an extension of what is being said in the earlier statement, what they have previously experienced. Therefore, the first messages, they would carry the most weight, and they have to be very carefully calibrated. And people also limit intake of new information. As I said, if people simplify, they cling to current beliefs, and very little new information would be assimilated by them. Next. What would be the concerns of people affected by a crisis? Obviously, what would be my concern? The same would be the concerns of that community which is affected. Am I safe? Is my family safe? What you have come as a responder, a multi-sectoral, multidisciplinary team, but what is it that you know that may affect me? What is it that you have found about this incident or this crisis? And what can I do? Would you be sharing any information that I can use to protect myself and my family? Lastly, probably they would be interested in who caused this and can you fix it? When we come on to the media section, you'll see how this changes, turns around on its head, where the last questions become the first for the media. Next, please. So certain key concepts, quickly going through them. When people are stressed and concerned, they typically, number one, next, please. Highlighting, they want to know that you care before they care what you know. It's a very simple statement, maybe a beautiful play of words as well here. They want to know that you care. So it is the empathy, it is the feeling of care that you come with as a team, as a responder, even before they care what you know. They would not be interested in your PhD degrees or my CDC fellowship or my PHEDM credentials. But what they would be more interested is, do I, as a responder, care about the community? Next, please. They would be having difficulty hearing, understanding, and remembering information. So that is the reason why often it is stressed that the messages have to be very, very simple, what people can assimilate. Next. So talking about the first one, therefore, there are certain concepts, certain time-tested, scientifically tested methodologies, how the messages are to be given. So like everything in threes, what that means is that three key messages, and each message should not be, it should be delivered like in 9 seconds each. So 27 words, 9 seconds, three messages. So multiples of three. Repeat at least 3 times every message. This is again another principle which has been tested extensively and found effective. And provide 3 supporting facts or credible sources for each key message. I am saying that you get vaccinated for COVID-19. I'll have to provide at least three supporting facts that this is what leads to a better outcome when you are vaccinated against COVID-19. Next, please. The third is that people are willing to trust they trust most those who are willing to acknowledge the importance of uncertainty. So the thing is that people know the best. They know what is happening and how things are unfolding in front of them. And when somebody external to that community comes and says that everything is under control, I mean, that is not going to cut any ice with that community. They know that if everything was under control, we would not have landed in this situation in the first place. But a risk communication expert who's there with the team, and he states that while there is uncertainty, while we are not out of the woods yet, while efforts are being undertaken, but there is a risk of there is this uncertainty element. People would trust such a message more than the message which says that everything is under control. Next. So on the basis of these, what we have so far seen, there are certain principles that we can now summarize, that during a risk communication exercise, we do not over-reassure people. We reassure, we express empathy, but over-reassurance doesn't work. We acknowledge that there is a process in place. People are more interested in knowing what is it that is being undertaken, what processes, what systems have been put in place, rather than the outcomes of those systems. It differs. While administrators and media, they would be interested in knowing what are the outcomes. People look at the affected community, looks at the processes. There have been 100 beds which have been provided to deal with this emergency. They will be looking at those 100 beds, not ultimately at the end of the exercise how many lives were saved. Express wishes, give people things to do, so that as I referred to, it breaks that cycle of inaction and helplessness, hopelessness. And often we feel that affected communities, they would not be able to contribute much, but it is probably a misconception that we go with. We should ask more of people, and if we ask more of people, people are willing to deliver more, especially in crisis situations. Next. Some more sets of some examples where these have been with due acknowledgement. These have been taken from the various IEC material and risk communication material from WHO and CDC. So when the news is good, state continued concern before stating reassuring updates. So it's very easy to say that now we have controlled everything, that the situation is totally under control and this outbreak is now over. However, a better way would be, haven't we seen second waves of diseases coming? Haven't we seen things suddenly taking a turn for the worse? So the initial better message would be that, I quote one of the messages, although we are not out of danger yet, we have seen a declining number of cases each day this week. So it indicates that the things are taking a turn towards the better, but it's not yet over. Next. Under promise and over deliver. This is one of probably the most important principles where the teams they are responding. The tendency is to over promise and under deliver, but the idea is a sound strategy is always the other way around. Next, please. Allow people the right to feel fear, afraid, because people are in that situation. They have every right to feel concerned about, to feel afraid that some things may not go the way they want it to. So acknowledge that, acknowledge the fear and give contextual information. Next. So to summarize, the initial message must be therefore short, relevant. It should give positive action steps. Do's and don'ts therefore are very often used in risk communication strategies, and it should be repeated as often as possible. Next, please. The initial message must not use jargon. So the ADC says to CDC that NCDC must come in with the DGHS. This is all jargon to the community. But when it's risk communication, crisis situation, it should be without any jargon. It should not be judgmental because you were living in this area, because government had been saying to evacuate these lower lying areas and therefore you are facing these floods. No, making promises that cannot be kept, and this is not the time to humor. Humor is an excellent skill in communication, but certainly not during a crisis period. Next. So we, at this stage, we've come from talking about the risk. I'll just request my team keeping a time as to where we are in terms of the time availability. We started at 3:45 probably, so 25 minutes already, 25 minutes gone.
We have 7 minutes more.
So 7 minutes more going by the clock. So okay, we'll stick to that. Working with the media. Media is something that we willingly or unwillingly have to face, especially during a crisis situation. Next, please. But we should remember that media is not our audience. And we should never forget, as risk communicators and responders, who is our audience. So working with the media during a crisis, there will be tremendous pressure from all quarters. It must be, therefore, the information that we are sharing, it must be fast and accurate. It's like cooking a meal when people are starving. And if information isn't finalized, then to media, explain the process once again. What are the questions? So when even before we go and interact with the media, there should be a mental preparation as to what is it that the media is going to ask. And these are the questions taken from the WHO handbook, a list of 77 most commonly asked questions by reporters. Some of them are: what happened? Who is in charge? Has this been contained? Are victims being helped? What can we expect? Things like that. So what happened and who is in charge? Media would be like, media, disasters are a media event, crises are media events. So they would want to know whose head should roll first, who was in charge or who is currently in charge. So these are some of the questions. Did you have any forewarning, etc.? Next. So as I said, disasters are media events. So media will be there. It is their livelihood that depends on reporting these events. And they know how to reach their audience and what their audience needs. So we are not experts at reaching out to our audiences because we don't do it day in and day out. But media does it day in and day out. So rather than viewing media as something which can be avoided, let's use them as partners. It would be an excellent strategy to have them as our partners. They know how our message that we intend to disseminate to the community can be done. Next. So this is again a repetition of what we have said. It's not our job, but it's the media's job, and how the responding team should know that they can't dismiss media when they are inconvenient, except that media will be involved in the response and therefore plan accordingly. Next. The response officials should also keep in mind that they address all media with equal access. There should not be any preferential or discriminatory treatment especially when dealing with media. They use technology so that the message is fairly distributed. 4 p.m. bulletins every day. That is for all media houses, whether they are present or not. Plan to pre-credential media for access to restricted. Suppose if there's an EOC or a control room where the media briefing is going to happen, so that only authorized personnel have access there. And the messages that are delivered should be consistent. Next. Response officials should not, especially when dealing with media, hold grudges against any media that there was a negative reporting done, there was a negative piece in that particular newspaper. They should not discount local media that has the maximum presence and maximum impact too. And we should not be telling media what to do. They know their job, we should be knowing ours. So reporters want front seat to the action, and they want all information right now. So preparation for such will save not just this crisis handling, but also relationships with the media. If we don't have facts, then as I said, tell them the processes. Media too, we should know that they are affected by crisis because they have to be the first to reach, first to report, sabse pehle, sabse tez, things like that. So they are also in that race, especially in a crisis. When we don't have food and water and shelter in that crisis, media also coming from various places would be affected by the same things. And to add to that, it is the lack of scientific expertise that they have. While we may be there as scientific experts, the media is not scientific. So it will cook up scientific expertise if we do not provide it to them. Next. So it's essential to have, therefore, a command post or a control room where these things can be managed efficiently. Next. And the last bit is media handling, crisis communication. This is both a science as well as an art. So far, we were talking about the science part of it, which can be learned, which people can be trained in. But then there's also an art component, a natural component that some people are better spokesperson, and therefore they are designated as spokesperson for their agency or for that particular response. So let's quickly see what would be the characteristics or so the role of a spokesperson in emergency is it takes the organization from an it to a we, combined. It's an ownership. The spokesperson speaks for the organization, and that results in building trust and credibility for the organization. It also removes psychological barriers within the audience, gains support for the public health response, very crucial, and ultimately reduce the incidence of the impact of that particular crisis. Next. The spokespersons may also suffer from some pitfalls, which we have already said, that humor, jargon, showing off the vocabulary and expressing personal opinions, focusing too much on the negatives are some of the jargons, some of the pitfalls that the spokespersons should avoid at all costs. Next. Attributes, these are the last few slides. They are authentic, great. The spokesperson, best spokespersons, they are authentic. They don't have to pretend. Their audience may not agree with their perspectives, but they would state what is the fact. And therefore, natural and authentic, I think they are two sides of the same coin. Third is they are flexible. That based on the new information which is available, they would be able to change that perspective and genuinely bring it out. Next. they speak to their audience. They know that media is not their audience. They know that channels are different, but ultimately to reach to their audience, they would speak to their audience. They self-edit based on their job is to reduce information. So how to make that message simple? There's very complex science behind COVID vaccination and other things. But how to make it simple? How to let even a person who's not from that background or not that knowledgeable understand that. And sixth and finally, they know to express their points in a compelling manner. So a forceful message that is given, which is then accepted by the community. So these are some of the traits of a good spokesperson. Next. And lastly, I think this is the final last. I've been saying last probably for the last 2-3 sections, and I think this is the last section. Social media, we cannot ignore. We cannot afford to ignore this, especially during a crisis. Next. There are some goods about the social media. It needs to be where people are. It's there on our devices. So whether we talk about Twitter, we talk about X now, we talk about Instagram, YouTube, and whatnot. It is there right in our hands. It leverages unique characteristics of emerging channels. Tailored health messages can be sent to those communities, and it generally empowers people in making health decisions. Next. But it also comes with the flip side that because it is there everywhere, so rumors can go viral in a very short time. Lots of noise, the message may be lost. While our message is COVID vaccination, it may focus about some other things. And the spam and the other things, they may also play a role. And there, everyone is an expert. Content creator, every content creator thinks that he or she is an expert on the subject. And hackers and spammers, they would gain the opportunity to get into your systems, whatever be the situation. Next. So to summarize, information is only as important as its timeliness. I didn't touch upon this before, but just a moment that timeliness is the crux of risk communication during crisis, more importantly. Not all information is for everyone. There's lots of information that may be available with the responders, but then it should be understood. Some of it is for media, some of it is for decision makers, some of it is for politicians, some of it is for community. Everyone wants the information to be simplified, and that is more so during a crisis. And with that, I take a pause. I think we overshot by 5 minutes.
No, sir, just 2 minutes.
Just 2 minutes. So thank you very much for the timekeeping, and I hand it back to Stanzin now.
Thank you, sir. Thank you, sir, for that detailed presentation on risk communication and community engagement. And you clearly explained that the key principle, the importance of effective community engagement and the vital role of a spokesperson in emergency communication. And your insights have been provide participants with a practical understanding of how this element strengthen the risk communication and response. And your insights and commitment towards the strengthening community awareness and the preparedness are greatly appreciated, sir. We believe your efforts will go a long way in promoting effective communication strategies and building resilience, community resilience. Thank you, sir.
Thank you.
We now invite to participate in a first quick poll to capture your feedback from this session, please. At the bottom of the screen, you will be seeing at the right sign, there will be Slido. I hope everyone will be visible the Slido. Question states that during an outbreak, misinformation spreads rapidly. What is the most effective risk community engagement response? First is ignore misinformation. Second is punish people spreading rumors. Third is provide clear, factual, and consistent message through trusted channels. Fourth is delay communication until all facts are confirmed. Kindly respond to it accordingly. Until now, we have received only 16 responses. Thank you each and everyone for the active participation. And now we move toward our second technical session. And it is my pleasure to introduce our keynote speaker for today's session, Dr. Bimlesh Joshi, Assistant Director, State Nodal Health Disaster Management, Health Directorate, Uttarakhand. This session will highlight practical on-ground experience of how effective communication and active community involvement played a pivotal role in managing and response to the disaster. Over to you, Sir Bimlesh, sir.
Thank you. Welcome you all. Good evening, everyone. Today, I will be sharing about risk communication and community engagement and practices that we adopt from Uttarakhand. No risk communication and community engagement, the basic and saving. So, main objective we have here provide clear and actionable information to the community, counter misinformation and rumors. We have to promote protective behaviors and encourage community participation and build resilience and trust among the community and among the affected community. Next. Please come on the next slide, please.
Already done, sir.
For me, it's not visible.
Sir, I'm in this slide number 1, major disaster in last 15 years in Uttarakhand.
No, it has not is. When you talk in the context of Uttarakhand, as we all know, it's a highly prone, disaster-prone state. For the past 2 or 3 months, we are experiencing different types of disasters. Among the major disasters, we have landslides, avalanche, glacier lake, outburst floods, lightning strikes. We have road accidents, epidemics, and one new thing that is in the community that's common among all over India, that is the selfie disaster. Now in Uttarakhand, we call it as a selfie disaster. Many of our disasters are happening, many of our accidents are happening due to selfie addiction among the young couples, young peoples. That also we have added in Uttarakhand. As Uttarakhand, we all know.
Sorry to disturb you. सर एक्चुअली ना आपकी वॉइस ब्रेक होके आ रही है, तो सर आप अपनी अगर वीडियो ऑफ कर लेंगे ना तो अच्छा रहेगा सर.
वीडियो ना
ऑफ कर लीजिए सर वीडियो. जी सर.
क्लियर? क्लियर नाउ?
सर जी सर, आपकी वॉइस बीच बीच में ब्रेक हो रही है, मे बी नेटवर्क इशू होगा, इसलिए वीडियो ऑफ के लिए रिकमेंड किया था सर.
Now it's clear.
जी
When
सर.
you talk about, as you all know, Uttarakhand itself is a Himalayan terrain, and the state faces multiple hazards. Like I had talked about cloudbursts, stress floods. Recently, we had Tharali incident. For the past 2 years, we are experiencing a lot of landslide events. Here at Dehradun itself, we experienced a lot of damage, both to property and livelihood also. Major incidents Uttarakhand are during winter in the ongoing this monsoon season. Avalanches are common in Uttarakhand. Lightning strikes, road accidents, and epidemics. Next, please come to the next. Next slide is not running, please.
Sir, already done, sir.
It's taking time, I think. Now it's clear. It's taking a little time there. So major initiatives, disaster risk management, what we follow in Uttarakhand, they are mainly, as we talk about disasters, so disaster, we all know there are 3 major phases of disaster: before disaster, during disaster, and after disaster. Before disaster, our main aim is preparedness campaigns and simultaneous simulations among the society. And during disaster, we work on real-time updates, evacuation information. And after disaster, we talk about messages, mental health, rebuilding trust among the community. And major thing that we follow in Uttarakhand in present data are the decision support system, fixed protocol, who is the at the highest level, who will be taking the decision, whose decision will be applicable. And we have early warning system about floods, about this at Uttarakhand. And the state itself has a very well built and very modernized SEOC, state administration. We have got a separate SDRF building with multiple functionaries. We are all we have a team of experts that are monitoring of high mountain hazards. And our incident response system, as of Uttarakhand, we talk, we day to day during this monsoon season itself, you might be hearing through various channels. At Uttarakhand, we are experiencing different type of disaster events. So our IIS is the best fortified among various states. We have road application management, interagency group. We have line department, state department. In Uttarakhand itself, we have about 22 departments. In case of any disaster or eventuality, all the departments work in coordination, cooperation with each other. And time to time during peace period, we can say we have conduct training and capacity building activities, IC activities. In further slides, we will be talking about IC activities. And post disaster, we work on resettlement and rehabilitations of the community. Satellite communication in remote areas, we have got at Uttarakhand itself, we have got more than 300 satellite phones in case of any eventuality where we in cut-off areas and far-off areas where our communication system disrupts. There we supply the satellite phone to the local community. From there, they can communicate us through satellite communication. And it's in Uttarakhand, we have a separate department for landside mitigation management center. We call it DLMMC. Next. Please for next slide. Next slide, please.
Sir, hope you are able to see slide number 3, pre-disaster
Actually, I'm in
preparedness and awareness, sir.
Now.
Char Dham Yatra. Yeah.
Yes. Now it's clear. Now, as of when we talk about Uttarakhand, as I stated earlier, so we have time by time we have different events in Uttarakhand. Our Char Dham Yatra is one of the events that every year we have to conduct it. So before that Char Dham Yatra, so we have to make all arrangements like you guys be seeing in this slide. The Char Dham Yatra brings millions of pilgrims in Uttarakhand. The government we issue SOPs to different states in different languages. Right, this year we issued about in SOPs to different states in 13 languages, so that the local community of that state or that those people who can't understand Hindi or English also, they can understand the SOP in their local languages. So this year we had issued SOPs in 13 languages of different regions, be it South or North region or Eastern region. And that has been disseminated through our government by different means or through that government of the concerned state through, and when pilgrimage reach Uttarakhand, so through various means by SMS or digital boards, loudspeakers, banners, we all communicate this about this communication. And prior to Char Dham Yatra, we conduct training, a small training of first aid type of training of hotel managers, dharamsala staff, that mule holders, and all pilgrim, those involved in this pilgrim yatra. So a small at different various spots we conduct first aid like our workshops. Their community participation is ensured so that community participates well, and in case of any eventuality, they don't stand blank like the hoteliers. Now the hoteliers know in case of eventuality, if any patient suffers from any cardiac arrest in this hotel, he knows how to do a CPR. Or among the when you go to Kedarnath yatra, जो हमारे घोड़े खच्चर वाले होते हैं, they very well manage the patient in case कोई patient उनके गिर जाता है या in case any patient suffers from high altitude problem, he knows the primary treatment. By the time our teams reaches there or our help reaches there, the mule handlers or the local जो वहाँ पर जो ये local stalls वाले होते हैं या local shop वाले होते हैं, they manage the patient and they very well do it. And these people are identified people. Please go to the next slide. And
Done
when we
from
talk
my
about
end,
it,
sir. सर मूव कर दिया सर.
हाँ, वो थोड़ा सा आपका और मेरे में थोड़ा टाइम लैग हो जा रहा है. कोई नहीं, take a little time. So when we talk about the various channels of communication, we have various channels like mass media through radio, newspaper, televisions. Now we have this WhatsApp means, and through this all other communication, we disseminate our information to the common public, to the local public, to the yatris. And digital media, as we all know, in the present situation, we have social media, websites, SMS alerts. We talk about cab messages, and there are community networks in certain community. As we talk about Uttarakhand, we have different areas have different type of disaster, different type of eventualities. So among the community, we have local community networks like local teachers, local leaders, influencers. In Uttarakhand, we have trained almost more than 2,000 Abda Mitras. They are working very well during any disaster or any eventuality. On ground, when we talk about any physical display of, we have got posters, pamphlets, and during any disaster, any outbreak or any latest any disaster activity, we make announcements among the public about what to do, what not to do. And during school period, during peace period, we do meetings with the local community, with the local influencers, and like on we ensure the community participate in all these activities. Please next. In Uttarakhand also we have 24/7 104 health services. Any pilgrimage, we display this helpline number. If any pilgrimage regarding his health or any problem, he can communicate to this 108 and 104 number. And in the universal number of India is 112. So these are our three major numbers: 104, 108, 112. In case of any pilgrimage, he faces any or any people community member, if he faces any disaster, any it needs any help from ourselves, from specific help, from police, from health department, or any department, he can call to anyone, either to 104, 108, and 112. Then from 112, the message is disseminated to the concerned department. These are the various means that we during yatras we display, we make through social media, through local media, and through our boards, signboards, and all of this. We display all this matter in the society. You might be, is it visible to all, no?
Yes, sir.
जी sir.
These are the ways what we can do, what we do, do's and don'ts during yatra for the common yatris. Come please next slide. In Uttarakhand, recently we had two major incidents, like you all might have heard about Kedarnath incident in 2013, and after that we had Silkara Tunnel incident in 2023. There are in year 2021 in Jyotirmath we had now that is Jyotirmath, previously it was known as Josimath. We had a rainy outbreak where whole of the dam was breached. And recently in this year, we experienced a lot Uttarkasi, Dharali incident. Here at Dehradun, for the past 2-3 days, we are experiencing all this. And at Josimath, due to the sinking zone, Josimath, what we call Jyotirmath, it basically it's established in a sinking zone of area. It's established on glacier sand. So when every mountain, every hill station has its particular carrying capacity of the public or any domain. So when the carrying capacity of that domain or public exceeds, then we experience all these landslides or sinking of the lands or developing cracks among the houses and all this. So when all this had during this period of basic influence or basic aim was to just make community aware and to have community engagement in all this. In Josimath, before the subsidence crisis, to certain preparedness and awareness activities were already conducted. Local leaders were involved, local influencers were involved. People were not ready to give up their livelihoods, to give up their houses or their residence during the landslides and during the cracks that developed in their houses. So now what happened now post this disaster? Now we are doing risk mapping and scientific studies are undertaken. Various help agencies like Wadia Institute, IIT Roorkee, and from Delhi, and all major institutes that work on landslide mitigation. Now they are working systematically and scientifically and how to minimize the after effects of these cracks and all this, and further how community participants can be involved in all this. Next. When we talk about post-disaster recovery and community engagement, then Josimath subsidence, we did continued community consultation for relocation, rehabilitation. The major thing is after disaster, the main concern is the rehabilitation of the society. Their earning, their livelihood is lost. So we have to build trust of the community. For this, we have to do community consultation, relocation, and rehabilitation, awareness on safe construction practices that public should to avoid further any damage. So we conduct awareness campaign, how they can build up their new buildings, how they can mitigate the further any damage to their houses, their livelihoods. And during Char Dham Yatra, when we conclude our Char Dham Yatra, we have a post Dham post Yatra, we conduct our review. We take feedbacks from the villages, from the local stakeholders, from the local community, what went wrong during this Yatra, what were the various drawbacks from the, as you talk about health department, what were the various drawbacks that we can meet out for the coming next Yatras and all. And all these activities is being documented by us. Anybody can come and take a view of this, our various activities. Next, major information activity education IEC, as I showed you in the previous slides, major IEC activities are hoardings and during in radios, TV programs, jingles and talk shows, campaigns, nukkad nataks. We conduct nukkad nataks also in case of any major community involvement where we feel the importance, where we feel the need, community should be engaged. We involve the local community, we conduct nukkad nataks and all this. Next. When we come to about IEC, the way the comment has widely said, awareness material on monsoon preparedness, landslides, earthquake, school safety is our major concern. At school, we conduct various mock exercises with the help of SDRF and DRF. They train the school children about what to do during a major outbreak like earthquakes or what, and major flash flood events or during any major events, how to get them safe, how to conduct CPR, and all these activities are conducted time to time among the societies. And basically, we are among the school children, because school children, we think they are the best spreader of our message among the community. And during heat waves, we don't explain. During cold waves, like also how to do's and don'ts of activities of cold waves. And for those who come for trekking to Uttarakhand prior to the starting their journey, we educate, we communicate to the tour holders how to build confidence in the people who are coming to the hills, how they can meet out the high altitude problems and all this. We just train the local tour organizers. And through bulk SMSs, also we make community aware of the upcoming disasters and all this. And Uttarakhand, I think, is the only state that has developed a Uttarakhand Bhukamp Alert app. It is named by Bhudev. Anybody can download it from the Play Store. And though they are working, the experts are working, it is not so much time bound. It takes a little, there is a little, I should say, a little difference in the alarming system, but experts are working for forthcoming to in future. It will be the best app for us, which can alert us about the upcoming earthquake in case of any major outbreak of magnitude more than 5 degree. Next. Now we come out, all are aware about the COVID-19, need not to say much about it. What were our various challenges during that? Initially, when COVID outbreak came, then all of the community was unaware what was the virus, what was the various challenges, what can be done, what not to be done. And slowly, when we developed community trust, when community engagement, the people came to know what to do, what not to do, what to follow, and whom to follow. It also matters whom to follow and what to follow. So initially, in global scale, it was uncertain what to do. Then when by time, and it continued for a long time. Then at local levels, through various channels, we started community participation and all this. Next. There are multiple channel of dissemination. Initially, when it was not much, then reaching everyone everywhere was the motto. Traditional media, daily press conferences, TV, radio, ads, digital and social media, by various means, Twitter, Facebook, and all, we disseminated our messages. Official websites were made, and local outreach by posters, by banners, and by loudspeakers. We tried to educate the community, we tried to inform the community, and we tried to develop scientific behaviors among community about all various means during the COVID, what to do, what not to do. And major lesson that we learned for the future was trust is paramount. So any community, any activity, then only we can achieve success, unless and until we develop trust among the community. It is a paramount. It must be built before the next crisis. We should not wait for any crisis to come. Then we should approach the community prior to, when we are aware our community is facing such a such type of activities, such type of disaster coming year and year on, such activities keeps on going on in our community. So prior we should educate the community well. We should be well aware what are their basic needs. As per their needs and demands, we should conduct this dissemination of our, communicate with the community and dissemination of all activities. Next. And when we talk of COVID-19, there is a lot we have learned about what to do, what not to do. Next. This in Uttarakhand, we are implementing this community radio policy that is done by Uttarakhand to strengthen our this communication. Many places when we get our all means of communication back to by radio, by ham radio, we disseminate our messages to strengthen risk communication and community engagement through local media. We empower our communities with timely, reliable, and local language information. The main thing is what we try to say to the community must know, the community must learn what the government is trying to say, what the government is trying to communicate to us. It should not be in what a lot scientific thing. And basic key pieces are establishment of community radio stations across disaster prone area. We have done that. Local content, what are the local practices and what are the local means by which community can be best educated, best involved in any disaster activity. We implement that things. We have integration with disaster management and emergency operation center for real-time update. In Uttarakhand, our real-time response is we have come to 12 minutes. In case of eventuality, within 12 minutes, all our system is ready to meet any eventuality. For the past 1 year, we are having a very good experience. We have reduced our real time during any disaster. So during any activity, we basically insist on two-way communication from the public to the community, from ourselves to the community, and community to ourselves. What we want to say to the community must know what community needs from us, what is their demand. We must understand. And basic significance of our risk communication and community engagement is build last mile connectivity in remote areas. हम कहते हैं अंतिम छोर पे बैठा हुआ व्यक्ति that we say, तो our main aim should be to reach to that person जो अंतिम छोर पर जो बैठा हुआ है उस तक हमारा पहुंचना, उस तक हमारी सेवाएं पहुंचे. That would be the best. And our mean of communication should be have timeliness. It should share information quickly to the community. It should be accurate. It should be fast, fact based, not on rumors and all this, evidence based. It should have clarity, simple, jargon free language should be there. And one of the major motive is it should have empathy. That we want to say to the community, we should develop empathy. We should acknowledge community fears. And consistency must be there. Same messages must be delivered from all agencies. ऐसा नहीं कि हेल्थ डिपार्टमेंट कुछ और बोल रहा है, हमारा पब्लिक डिपार्टमेंट, इन्फॉर्मेशन डिपार्टमेंट कुछ और बोल रहा है और डिजास्टर डिपार्टमेंट कुछ और बोल रहा है. तो और मैसेजेस मस्ट हैव कंसिस्टेंसी. कोई भी एजेंसी का कोई मैसेज डिसेमिनेट करता है तो दे शुड बी सेम. And above all, there must be transparency in our messages. What we want to say to community, it should be clear and implicable to the community. Next. Before that, I should say, how can we involve the community? Just few points I would like to focus. We can identify and engage local leaders. We can conduct community awareness campaigns. We can engage two-way communication that I talked about. We can use culturally appropriate message. In Uttarakhand, it's called Devbhumi, so people understand very well to the culturally appropriate messages if we communicate to them. And we involve volunteers and youth groups in all our activities. As I said, we have Abda Mitras at Uttarakhand. During any eventuality, they all participate actively and they are very well aware of what is their responsibility, whom they have to follow, and what they have to do. Next. Key learning from, we should say, early warnings. The more early warning we give to the community, the more we make aware the community, the more we can save the life. As earlier I told, we have the main motto of our RCCE is building trust and saving lives. And during any disaster, we should have transparent, empathetic, and multi-channel communication to reduce any panic among community. And post-disaster, without community participation, as I told, we cannot achieve any of our target. To community engagement and community participation through, as we say, through cooperation, coordination, and collaboration, or three C's that we talk about, and two more, community participation, community engagement. So community engagement is vital for trust, recovery, and resilience building. Next, and few of the challenges I will talk about that we have in the last two challenges that we face during risk communication and communication. They are language and literacy barriers. Mainly during Chardham Yatra, people from all over India of different language and different cultural beliefs come to India. So it becomes a little difficult for us to communicate to them in their language when they come over to Uttarakhand. So language and literacy barriers are there. Sometimes to create rumors, to create कौन सबसे पहले वाला, डॉक्टर हिमांशु सर है टोल कि सबसे पहले वाला जो मीडिया का जो रोल होता है, तो दे क्रिएट मिस इन्फॉर्मेशन rumors about community. That are our challenges and lack of trusted authorities. इन केस अगर हमारा कोई पहले कोई इवेंट्स हुआ और हम कम्युनिटी की नीड्स को डिमांड को नहीं फेस कर पाए एंड नेक्स्ट टाइम सेम इवेंट्स रिपीट सेम इवेंट रिपीट्स इन द सोसाइटी, देन सोसाइटी हैव a little less trust in ours. So that is also a challenge for us. We have lack of trust in authorities. There are some technology gaps also. During any disaster, different technical institutions have different ideas, different ideology about meeting of any disaster. So they talk about different ideas, different implications of their technicity. So this is also a challenge. And after all, overload of conflicting information. One of the most challenges, overloading of information. During any eventuality, people from different sources try to reach us, try to reach our disaster management center, SCOC. They can try to communicate. Sometimes they communicate misinformation among us. कभी कभी ये होता है कि हमारे पास इन्फॉर्मेशन आती है और वो इवेंचुअली होता ही नहीं, उससे क्या देयर इज लॉस ऑफ टाइम एंड मैन पावर आल्सो. एंड ओवरऑल इन उत्तराखंड for the past we have learned a lot lesson from the Kedarnath event and this Silkara event and some this Rini event and Jyotirmath event. Now we are in a good position for our risk communication and community engagement. Hope I would have communicated to my best, though I am not so eminent as Dr. Himanshu sir and all. Thank you all.
Thank you, sir, for the sharing the valuable best practices of risk communication and community engagement from Uttarakhand and covering experience for Chardham Yatra, Silkyara Tunnel incident, Joshimath land subsidence, etc. The key initiatives you have highlighted, such as early flood warning system, training of APDA volunteers, and NDMS pilot projects, provide excellent insights on how risk communication and community engagement can be effectively implemented in diverse emergencies contexts. And thank you for your valuable reflection and for taking us through a case that underscores the importance of preparedness, local engagements, and trust building in disaster response. We deeply appreciate that you brought forward practical on-ground experience that emphasized the power of communication and community involvement in managing crisis. Thank you, sir.
Thank you, ma'am. Thank you.
Dear participants, to take a quick poll to gather your reflection on the second session, please respond according to your. I hope everyone will be seeing the Slido. And the question states that the development of the Uttarakhand Bhukamp Alert app is a part of which RCCE strategy, early warning and risk communication, financial compensation scheme, infrastructure development, and post-disaster insurance settlement. Thank you everyone for your active participation. And now we have come to the question and answer session. And I would like to request two participants to raise your question or queries in the chat box. And we encourage you to share your queries or reflections from your local context as this is a space for shared learning. We have one question for Dr. Himanshu Chauhan from Mr. Anil. Is RCCE restricted to periods of impending or continuing risk only? Would IEC in the inter-crisis period can be considered as a type of RCCE?
Thank you, Stanzen, for reading out that question. So when we say that RCC, and we should also know that RCC and CRC, there's slight difference between the two. So RCC is continuous. RCC doesn't mean that we only have to come in. The component of RCC that kicks in during a crisis is specifically crisis and emergency risk communication. RCC is overarching. RCC covers all the phases of disasters and emergencies, from the phase where there is no emergency or crisis, when we are in the peacetime. From that period onwards, our preparedness, our strategies to be finalized, to the time when it is actually implemented, where it takes the hue of a crisis and emergency risk communication, actually during the crisis period. So I would say that yes, it is not only during impending or imminent crisis. RCC is a much broader term, which encompasses all aspects and all phases of a crisis.
Thank you, sir, for answering this question. And one question is for Dr. Bimlesh Joshi from our participant, and states that, brief please how IDSP Uttarakhand involved in disaster.
During disaster now, we have concept of PHEOC. By collaboration of NIDM, CDC, and we are conducting public health emergency in PHEDM and PDM workshops at various places. We have developed PHEOC concept, Public Health Emergency Operation Center concept. During any disaster, post-disaster, as we all know, there is fear of communicable disease, waterborne disease, vector-borne disease. So in that concept, our IDSP has a vital pivot role in meeting the community needs and to avoid any further health issues, health hazards among the community. For this, now we have developing, as per guidance of NCDC, we are developing PHEOC concept, and that is helping a lot. And we are in the, though we are in the initial stage of this, in the coming future, I am confident that PHEOC will come forward as one of the pivot agency for us, one of the pivot agency for us to meet any health hazards post disaster mainly. Thank you.
Thank you, sir. Thank you, sir, for answering the questions. Now I want to thank you all the participants for active participation. Due to time constraint, we are not able to answer each and every question. So we have picked selective questions to answer by speaker. And for your information, our panelists answer your query in the chat box. Kindly go through it. As we draw this enriching session to the close, I would like to acknowledge the support of Shri Madhu Vyas, IAS Executive Director NIDM, Professor Dr. Ranjan Das, Director NCDC, Country Director CDC
Stanzen.
India. Yes, ma'am?
Yeah, sorry to disturb you. Actually, Dr.
Yes,
Sanket sir joined us for concluding remarks.
Okay, sorry, sir. Now I would like to request Dr. Sanket Kulkarni, Joint Director NCDC, for his closing remarks. Thank you. Over to you, sir.
Thank you, Sanjan. Thank you, Dr. Harjit. So in today's webinar, we learned regarding the risk communication, exactly how to coordinate, analyze, or develop some of the key messages, and how to disseminate them. Majorly means what needs to be disseminated, like it should be consistent with the risk communication principles, what sir said regarding the three bullets, and it should be in a plain written language. It should be accurate, and it must be fast, and it must be very accurate. And it should be appropriate for the intended audience, as we saw. We also saw that what Dr. Bimlesh Joshi sir said regarding the how that communication response will help during the public health emergencies, how they have activated during the Uttarakhand disasters that we saw. Then can it actually translates, or can it be properly disseminated during this messages to the key audience? Who are our key audience should be finally, you must know who are the key audience and which messages should be focused to which audience. Like media persons are having a different kind of questions, as sir mentioned. Similarly, for the general public, it will be a little bit different. So these kind of emergency messages are very essential, and the monitoring regarding the social media, infodemic management, etc., are also very, very important. and it should be coordinated with at all levels, like local, national, international response, the media channels, etc. And it should be managing the communication messages for all the response agencies should also have some kind of communication within themselves or between the groups, as it was very well mentioned. So these are some of the key messages which today's webinar series gave us as a part of risk communication and community engagement part. So I would like to thank the speakers who have spoken very well regarding these two, the Dr. Himanshu sir and Dr. Bimlesh Joshi sir. And also I would like to thank Dr. Surya Prakash sir and Dr. William Abrams, who is from CDC country of director, and the other participants and the panelist members here stands in. Dr. Sujit sir is also there, Dr. Harjeet, who have coordinated this webinar series in a much better fashion. So thank you everyone, and hope we'll meet next time in the 6th module of the PHEOC. As sir mentioned, regarding these modules will help us to grow and develop and use them when it is actually needed in the PHEOC, that is Public Health Emergency Operations Center, during this crisis, especially the public health emergencies and disaster management. Thank you. Thank you, Stanley.
Thank you, sir. Thank you, sir, for your valuable insights. And I would like to acknowledge the support of Sri Madhuvya's IS Executive Director NIDM, Professor Dr. Ranjan Das, Director NCDC, Country Director CDC India, Professor Surya Prakash, Dr. Himanshu Chauhan, Dr. Roona Hati-Gokhale, Mr. William Abrams. I would like to extend heartfelt thanks to our esteemed speakers, Dr. Himanshu Chauhan and Dr. Bimlesh Joshi, for their expert insight and real-world perspectives. And also thanks to our collaborative partners at NCDC, Dr. Sanket, CDC India, Dr. Rajat Garg, and my colleagues at the NIDM for their guidance and support in conceptualizing this monthly learning initiative. And also want to acknowledge Dr. Sujit sir also, and I would like to extend my heartfelt thanks to all the organizing team and all those who work tirelessly behind the scenes, and a special thanks to all participants for joining and engaging with us in this knowledge sharing platform under the PHEDM Connect Bridging Knowledge and Action webinar series. And the next webinar is on the topic of the psychosocial aspects of public health emergency and disaster management, and we look forward to your active participation in the upcoming webinar. Until then, stay safe and continue strengthening your role in public health emergency and disaster management. And thank you and have a wonderful evening. Thank you and Jai Hind.
Stanzin, before you finally sign off, I'll also like to thank and acknowledge the presence of Dr. Dhariwal sir, whom I saw in the list of participants. So he's been an eminent public health professional, as we all know, and a guru too. So thank you, sir, if you are still connected. Sujit sir has been acknowledged by Stanzin. So I'd also like to thank Sujit sir too.
Thank you, sir. Dear participants, we have pinned the feedback form in the chat box. Kindly fill it. Thank you. Thank you, everyone. Thank you for joining.